So now we enter the final section of this chapter on urine storage and elimination. Here we're going to check out the ureters, the urinary bladder, the urethra, how we void urine, and we're going to look at a reflex that controls micturition or urination. So we'll begin with the ureters. The ureter is a retroperitoneal muscular tube, and it extends all the way from the kidney down to the urinary bladder. So that's about 25 centimeters. It passes posterior to the bladder and enters from the bottom side. And then there are valves right where the ureters enter the bladder. They're flaps of mucosa, and it keeps urine from backing up into the ureter when the bladder contracts. There are 3 layers of the ureter. First of all, the adventitia, which is a connective tissue layer, and that connects the ureter to the surrounding structures. The muscularis is 2 or 3 layers. It's 2 layers for most of the length of the ureter, and 3 layers in the lower ureter where urine is entering, and it stretches and contracts in a peristaltic wave, and that stretching and contraction will draw urine from the renal pelvis down into the ureter. And finally, there's the mucosal layer, which is transitional epithelium, and it begins at the minor calyces up in the kidneys and extends down through the tubules and into the bladder. The lumen of the ureter is very narrow, and it's easily obstructed and damaged by kidney stones. The urinary bladder is the sac that holds urine. Now imagine if we didn't have a urinary bladder, there would be a constant flow of urine. Fortunately, we have episodic urination, which means that we can control when we release it. Good thing, huh? So the urinary bladder is also a muscular sac, and it's located on the pelvic floor. And it's right inferior to the peritoneum, so just below the peritoneum, separating the abdominal cavity from the pelvic cavity, but it's posterior to the pubic symphysis. There are also 3 layers in the urinary bladder. There's the parietal peritoneum, superiorly fibrous adventitia in other areas. The muscularis is a layer also known as the detrusor muscle. And there's 3 layers of smooth muscle, plus the mucosa, which is a transitional epithelium, if you remember from when we looked at tissues last semester. Transitional epithelium will change between one form of epithelium and the other. So there are several layers of this epithelium, and it causes these conspicuous wrinkles that we'll see here in a relaxed bladder. And those wrinkles will flatten up, and the transitional epithelium will transition into a single layer of cells as the bladder fills. You'll notice also on the floor of the bladder where the ureteral openings come in and the exit of the urethra occurs, there's a little triangular area which is called the trigone. And its smooth surface, this is often the site where we'll see bladder infections occur. The capacity of the bladder is about 700 or 800 milliliters. However, usually it fills to about 500 milliliters. It's a highly distensible organ. As it fills, it's going to expand superiorly, maybe 12 centimeters tall. And the rugae flatten out. The epithelium thins from 5 or 6 layers of this transitional cell type. As they stretch out and become more elongated, it seems to be 2 or 3 layers. So as we move on, the urethra is the tube that conveys urine out of the body. The female urethra is much shorter than the male urethra. It's about 3 or 4 centimeters long, and it's bound to the anterior wall of the vagina, which means that its external orifice, the external urethral orifice, is right between the clitoris and the vaginal orifice. It's a tiny little hole. The internal urethral sphincter is a thickening of the detrusor muscle, the muscle layer that surrounds the whole bladder. And this is smooth muscle, and it's under involuntary control. There's also an external urethral sphincter. That is where the urethra passes through the pelvic floor. These are skeletal muscles under voluntary control. The male has a very similar arrangement, except of course the urethra is much longer, about 18 centimeters on average. There are 3 regions. The first region that passes through the prostate gland is called the prostatic urethra. It's just a couple of centimeters. And then as the urethra passes through the pelvic floor, it's called the membranous urethra. And this is where we'll see the external urethral sphincter. Again, muscles that are part of the pelvic floor that are skeletal and under voluntary control. The third portion is the spongy penile urethra. It's about 15 centimeters and passes through the corpus spongiosum in the penis. It's the erectile tissue. The internal urethral sphincter, again, is made of a thickening of the area of the detrusor muscle, the muscle that surrounds the whole bladder. And again, the external urethral sphincter, part of the pelvic floor. So now there are 2 conditions that we'll examine that are problems in the urinary system. First of all, kidney stones. Kidney stones occur when there's sediment in the urine, in the kidneys. And it forms a hard granule of calcium phosphate or calcium oxalate, sometimes uric acid, or even magnesium. And magnesium salt is called struvite. And these stones, or calculi, will form in the renal pelvis. And often they're small enough they can just be passed unnoticed in the urine flow. But sometimes these large stones can block the renal pelvis or even the ureter, and they cause a pressure buildup in the kidneys, which can destroy nephrons. And that's quite painful. In addition, passage of a stone, if it is small enough to move through the ureter, they're quite large and jagged, and they're excruciatingly painful. As the ureter contracts against them, they're much like contractions pushing the stone through the tube. And those also can cause damage to the ureter, which may end up producing blood or hematuria, blood in the urine. Major causes of kidney stones, dehydration is one big one to pay attention to, especially at the altitude we live at. Also, hypercalcemia, having too much calcium, naturally some will precipitate. pH imbalances are going to have a large effect on whether solutes will precipitate and form calculi. Frequent urinary tract infections or enlarged prostate glands that can cause urine retention. Treatments for kidney stones, sometimes you can just take some dissolving drugs that break down the minerals, but often surgery is required. And now there's a technique called lithotripsy where it's non-surgical, using ultrasound waves to pulverize the stone, and hopefully we pass it in smaller fragments. The second condition are urinary tract infections, or cystitis. And cystitis is an infection often caused by exterior bacteria, and so it's especially common in females because there's a very short urethra, and bacteria can easily make it from the external towards the internal. Often bladder infections can be triggered by new or frequent sexual intercourse, but not always. Sometimes from stress, allowing change in acidity so that bacteria, the environment's more favorable for bacteria. And these infections can spread up into the ureter, and they can cause pyelitis, which is infection of the renal pelvis, so that becomes a kidney infection at that point. And if it actually reaches the cortex into the substance of the kidney, it will become called pyelonephritis. In addition to being a result of bacteria coming from the external environment in through the urethra, we can also find urinary tract infections coming from blood-borne bacteria that make their way into the urine filtrate. So voiding urine is otherwise known as micturition or urinating. During the times between urination, the bladder is filling and the detrusor muscles relax and allow urine to continue to enter. The urethral sphincters are tightly closed. And then voluntarily, the somatic motor fibers of the upper sacral spinal cord are going to signal the external sphincters to stay closed. The Micturition reflex is a spinal reflex that partly controls urination. Let's look at that. There are two components. There's involuntary micturition reflex and the voluntary control. In the involuntary micturition reflex, we're going to see that stretch receptors detect filling in the bladder and transmit efferent signals into the spinal cord. And the spinal cord signals return to the bladder from S1 and S3 area via parasympathetic fibers and the pelvic nerve. And those are going to excite the detrusor muscle and relax the internal urethral sphincter. And urine is involuntarily voided if it's not inhibited by the brain. And that's where the voluntary control comes into place. Involuntary control, a micturition center that's in the pons, is going to receive signals from the stretch receptors that the bladder is filling. And if it's timely to urinate, the pons will return the signal via the spinal interneurons and excite the detrusor and cause relaxing of the internal urethral sphincters. Urine is voided. If it's untimely, then signals from the pons are going to excite spinal interneurons that keep the external urethral sphincter closed. Again, if it's timely, those signals from the pons will release the external urethral sphincter and urine can be released from the bladder through the urethra and exit the body. So let's take a look at a little animation of that.
The micturition reflex involves impulses traveling from the urinary bladder to the sacral region of the spinal cord and from the sacral region of the spinal cord back to the bladder. It is coordinated by neurons in the spinal cord and can be influenced by signals from the brain. When the urinary bladder becomes stretched, there is an increase in the frequency of action potentials carried from the bladder wall to the sacral region of the spinal cord. In response, parasympathetic neurons from the spinal cord to the bladder are activated, and this causes the smooth muscle on the bladder wall to contract. The sensory signals to the sacral region of the spinal cord also stimulate ascending pathways to the pons and cerebrum, which results in a conscious desire to urinate. If urination is not convenient at the time, the brain sends impulses down the spinal cord to inhibit the micturition reflex. Impulses carried via somatic motor neurons keep the external urinary sphincter contracted, which also prevents urination. When urination is desired, signals from the brain stimulate the micturition reflex. The brain also decreases action potentials in the somatic motor neurons to relax the external urinary sphincter.
Now that concludes our chapter on the urinary system. Now you're ready to go to Connect and finish the full module of Learn Smart.